Hello, this is Arun Budathoki reporting for the New Brunswick Media Co-op. We are online at nbmediacoop.org. Premier Blaine Higgs delivered his State of the Province speech earlier this month. In it, he celebrated what he described as a booming economy and progress on issues including healthcare. But the New Brunswick Health Coalition says it was the speech of a premier who does not seem to understand the magnitude of the current healthcare crisis. Here are some clips from his speech.
We knew we could do better. And as I stand here tonight, I'm proud to say that New Brunswick is back. And we're back in a big way. And we're known across this country as a province on the move. We're no longer at the edge of the cliff. We're now standing at the cusp of greatness. And the only thing that is preventing us from moving further and faster is our own limitations, because we are thinking bigger and better. We're putting record amounts of money into healthcare, and we will continue to invest to get results. But as I previously just said, money won't solve it all. The reality is that we're going to have to do things differently. We're lifting up our most vulnerable. On our watch, nobody is left behind. And we need to continue to focus on where the real needs are and make sure that we indeed are delivering on that commitment.
Those were clips of Premier Blaine Higgs delivering his State of the Province speech on February 9th. The following week, the province announced a surplus of more than $860 million for the third quarter of the fiscal year. This comes at a time when tens of thousands of New Brunswick residents don't have a family doctor. Issues also include frequent temporary closures of emergency departments, among other problems in the healthcare sector. For more on these issues, we're speaking with Bernadette Landry. She is the co-chair of the NB Health Coalition. The coalition is a public advocacy organization dedicated to the preservation and improvement of public health. She is also a member of the NB Media Co-op's French language editorial board. Landry said the Premier's speech was disrespectful to New Brunswickers who are struggling to make ends meet. In December, the coalition published an 11-page document with proposals to address the healthcare crisis. The interview was recorded on February 16th. Here's what Bernadette Landry had to say.
I think Mr. Higgs is focused very much on the economy. That was his job. His whole career was about finance, and he's still managing the province as if he was managing a company. He still didn't get that this is not a company. New Brunswick is not a company. It's a population, and he's totally disconnected from the population. So for him, healthcare is, well, it's interesting it's important to him as far as it can give him some votes. But it's obvious that he has absolutely no interest in taking care of New Brunswickers. We've seen that since he was elected, really. That's it.
More than 50,000 New Brunswickers do not have a family doctor. What does this say about the province healthcare?
It says that the province healthcare system is, well, as elsewhere in Canada, is not going well. We are in a major crisis. This has been going on for decades. It didn't start with Higgs. It started decades ago. Governments have not taken seriously the fact that they could see in advance that the population was aging, that and that included healthcare workers, that there was less and less staff in the hospitals. That was easy to foresee, and nobody did anything about it. So when COVID came along, it just showed us how bad all that situation was. A situation that was already critical before COVID got even worse with COVID, because there were more people who needed to be hospitalized, and the people who were hospitalized needed a lot more care and all the procedures that healthcare professionals needed to add to their usual jobs was even more added to their jobs, and so it got exhausting. And now we're in this situation where the staff is more and more exhausted. They go on sick leave, and there's not enough people to take care of the ones who need care. So we're in a bad situation.
Mhm. Could you tell us more about the emergency response and the situation of seniors in New Brunswick?
Seniors are not very well taken care of. They're neglected.
Mhm.
One of the things that is wrong with that system is that we're supposed to have standards whereby seniors can get so many hours of care a day. That's a mathematical thing, but all the standards that they have for nursing homes and long-term care, they can have as many standards as they want, but if there's no way to make sure that those standards are respected, why have standards? So that explains why a lot of seniors go to bed hungry at night, because there's no one to help
Mhm.
feed them. There's a lot of seniors who stay in wet diapers for hours, and that's it's really not healthy. Sometimes they get their pills too late. That has an effect on their general health. So there's a lot of problems.
How do you think the province is dealing in trying to help them?
The province is not really doing a lot for seniors right now.
Mhm.
The Francophone Seniors Association published a report with recommendations. They had 6 recommendations, and some of them cost absolutely nothing, but nothing was done. No change happened. So it's like seniors are not taken seriously.
Mhm.
It's terrible, because those people are the ones who worked hard all their life. They spent their life contributing to society, and now they're being left aside.
Mhm. Mhm. Your organization has been critical of the premier's speech. Could you tell us more about this?
His State of the Union speech. Well, I think that was totally disrespectful.
Mhm.
He seemed to be in a party mode, celebrating how New Brunswick was well off financially. There's so many people who can hardly afford to put gas in their car to go to work, or to, and Mr. Higgs seems to be unaware of all those problems. It's ridiculous. He's not at all conscious of the difficulties that a lot of New Brunswickers have. Like I was reading an article recently saying how many children are poor in New Brunswick. New Brunswick is one of the poorest provinces in Canada. This is not a time to celebrate because we have a lot of money. This is a time to give money to those people who are poor, to allow them to be a little less stressed out, and take care of those people.
Mhm.
You know, it's difficult to understand.
The federal government has committed to provide more than $1 billion to the province for the health sector. Do you think this will make the health sector better?
Well, Mr. Higgs said that it was not
Mhm.
going to make it help the system better. So he decided that this was not going to help. So,
Okay.
but we were we wanted, the New Brunswick Health Coalition wanted that there be strings attached to the allocations, and that there be some data that would be collected, that the government, the federal government would say, okay, tell us where you're going to spend those dollars, and tell us what you're doing with those dollars. And in a year from now, tell us how things have improved. And if they haven't improved, what's going on? It's not a responsible way to manage the money of taxpayers. So I think it's just normal that we ask our government to be accountable for the money that it's getting from the federal government.
So what are the solutions to fix the health sector?
First of all, there needs to be a lot of focus put on retention of healthcare workers right now. And how do you do that? Well, you try to give them better working conditions. It's not normal for a nurse to work 24 hours in a row. It's not only not normal, it's dangerous for that nurse's health, and it's also dangerous for the patient's health. So this should not happen at all. So first of all, we need to retain the workers who are there. Not only the nurses, everybody. When you walk in a hospital, the first person you see is not necessarily a nurse. It can be someone who's going to ask you to wear a mask if you don't have one, and things like that. So all healthcare workers need better working conditions. And also we need to recruit. Why wouldn't those young people be encouraged by telling them, for example, if you promise to work in New Brunswick for 3 years after you graduate, well, we're going to pay for your university or college studies. That is a way to encourage young people to get into a healthcare profession. Things can be done. We need some willpower. We need to take that seriously, and that's what we think the actual government is not doing.
Thank you so much for your words today.
Okay, thank you.
That was Bernadette Landry, co-chair of the NB Health Coalition. She is also a member of the NB Media Co-op's French language editorial board. For the NB Media Co-op, I'm Arun Gurathoke.